My exercise physiology project was done on a study about the effect of exercise on gastric ulcers in athletic horses. The purpose of the study was to research how high-intensity exercise affects equine gastric ulcer syndrome in thoroughbred and standardbred racehorses. It was trying to determine the effect of continued training on the prevalence of ulcers. Equine gastric ulcer syndrome is a common disorder in adult horses. Gastric ulcers most often occur in the squamish portion of the stomach. This is possibly due to the lack of protective mucus and bicarbonate. Horses turned out to pasture and horses with light to moderate exercise generally do not have gastric ulcers. Gastric ulcers are very common in racehorses, however. It is estimated that 66 to 90% of racehorses have gastric ulcers. These are the methods that were used to conduct the study. 79 thoroughbred and standardbred racehorses in training were randomly selected. Their feeding and exercise were not controlled. Medications were recorded and no medications were given consistently. Also, all horses were in racing condition. Gastroscopy was performed on all horses. Horses were not given any feed at least 3 to 6 hours beforehand, and all horses were sedated. Following this, researchers used a scoring system to determine the presence and severity of ulcers. This is the scoring system that was used in the study. This is from Table 1 of the research article. Horses with scores of 0 or 1 did not have ulcers, whereas horses with a score of 2 or 3 did have ulcers. A score of 0 indicated that the horse had normal mucosa in the stomach. A score of 1 showed that the mucosa was intact but abnormal. There could be distinct areas of hyperemia or mild to moderate hyperkeratosis. A score of 2 meant that the horse had mild to moderate ulceration. There could be both superficial and deep ulcers that were less than half a centimeter in diameter. Horses with a score of 2 usually had 1 to 5 ulcers and might have had a small amount of bleeding. A score of 3 meant that the horse had moderate to severe ulceration. There would be more than 5 lesions that were greater than half a centimeter in diameter. These ulcers were deeper, and there was a small to moderate active bleeding. There could also be mucosal proliferation along the ulcer margin. These are the results of the study. Following the initial exam done on all the horses, 42% had a score of 0, 30% had a score of 1, 19% had a score of 2, and 9% had a score of 3. The average ulcer score after the initial exam was a 1.1. For the follow-up exams, 37% of horses did not have ulcers, meaning they had a score of 0 or 1. 51% had a score of 2, and 12% had a score of 3, giving an average ulcer score of 1.5. The percentage of horses with ulcers went up from 28% in the initial exam to 63% in the follow-up exams after continued training and racing. They also found that male horses had higher scores than females, and that older horses had higher scores than younger horses. This table, Table 2 from the research article, summarizes all of the ulcer scores. As you can see on the left-hand side, they broke it down into different data subsets. They have overall with all of the horses, and then they also broke it down into sex and age. Then on the right-hand side, they show the mean ulcer score of those examinations and any change that happened from the initial to the follow-up exams. The researchers found that the risk of gastric ulcers does increase with training. They also found that gastric ulcers may not be related to the administration of non-steroidal anti-inflammatory drugs, as has been previously thought. This research was posted in an article called The Effect of Exercise on Equine Gastric Ulcer Syndrome in the Thoroughbred and Standardbred Athlete, and it was submitted to the Journal of Equine Veterinary Science.